Hi, my name is Dr. Gabel, and I hereby pledge to ethically and honestly treat my hair restoration patients. In my practice, I am the licensed physician and surgeon, and I do all the harvesting of the donor grafts during follicular unit excision surgery. Why am I making this pledge today? There is a serious problem throughout the world that is going on right now where unlicensed individuals with almost no medical training are actually doing hair restoration surgery. What they are doing is opening clinics, and they're seeing patients and luring patients in with the false sense of treating patients well in hair restoration surgery. Patients often show up, there is no physician involvement, and a technician with maybe a weekend course of extracting hairs does the entire procedure from start to finish. Well, why is this bad? Well, number one, there are serious complications and consequences that occur with this type of treatment. Every day, we are hearing about patients who have been over-harvested, where too much of the donor material has been taken, so patients are permanently scarred in the back of their head. Often, the hairs and grafts that are taken from the back of the scalp and transplanted to the front of the scalp do not grow. I recently saw a patient who had 4,000 grafts, and he feels none of the hairs grew. All he has left now is a bunch of scar tissue in the back of his scalp and nothing to show for it. Of the hairs that actually do grow, many of them are growing in an abnormal direction. They're in an unnatural position, and overall it looks horrible. I, in fact, had a patient who had a surgery by an unlicensed individual, and they had a transplant in their beard. The person actually transplanted the hairs so they go straight up, and some of them stick straight out. This has been absolutely devastating to this patient. So now it's now taken me 2 transplants to repair him, and I'm not even done. So when you're thinking about doing a hair transplant, do your research, do your studying, go and meet the physician in the clinic. Make sure they have the credentials and the experience in hair restoration surgery. And most importantly, you want to ask the question, who is going to do my surgery? You want to make sure that is the licensed physician with experience in follicular unit excision doing the procedure. They should not be handing that off to a technician who has no medical training and no degree and is not licensed to practice medicine. That is a formula for a disaster. So, as I stated, I pledge that I will be treating my patients ethically and honestly. In my clinic, I do 100% of the excisions and extractions and harvesting of the hair, as I have always done and always will do. If you have questions, please visit my website. Thank you very much.